This video was recently sent to me for a reaction. Let's react to I got a Turkish hair transplant before, during, and after by Only Scrans.
1 year ago, I flew to Turkey to get a hair transplant, and I documented every single step before, after, and even during. In this video, I'm going to give a completely honest account of the process, from how much it cost to how much it hurt to how long it took to grow, month by month, including aftercare. You get to see it all. So if you're genuinely thinking of getting it done, this is the video for you.
We've done this also for some of our patients. If you want to check out a video, one of our patients, Max, for example, documented his entire recovery process. So some people do enjoy that type of video because they want to know how they're going to look at 3 weeks, how they're going to look at 3 months. So I think that's useful. Keep in mind that most of those videos are with a full head shave. We, of course, do no shave techniques too, but usually those people are a little bit more private and then less likely to document their full journey for the internet. So just keep that in mind. But of course, less shaving means quicker return to most social functions. So that's a big win for a certain type of person.
Let me start off by talking about why I made the decision to get this done. I don't think, as men, we discuss just how much an effect hair loss can have on our mental health. Some might be watching this thinking, oh, grow up. But honestly, when I started to go bald, my self-confidence dropped through the floor. I'd find myself cringing at photos taken of me where my hair loss was really visible.
So he's wearing his hair super short, so sometimes it's difficult to exactly see how much hair remains, but we'll see. I'm sure we'll get some other views. But yeah, of course, hair loss can take a really immense toll on people, and they look for ways to try to improve it. I mean, if options are available, that's very understandable, and luckily there are some great options these days.
It genuinely did knock me for 6, and I didn't think that there was anything that I could do about it. I've always been terrified of needles.
Okay, so here he is with his hair a little bit longer, and we definitely are seeing a receded frontal scalp. The frontal temple corners are receded. The temples themselves have pulled back a bit as well. He still has that anterior temple peak. He has a thin forelock, and he has some more hair in the mid-scalp, and then I can't really see his crown from this angle.
Or any sort of anesthetic. To be honest, I probably watched too many episodes of Casualty when I was a child, but for some reason, it's a real issue. And I was drinking so much that any period of sobriety needed for the operation was an absolute no-go. I wouldn't even board a flight without having 4 to 6 pints in the airport lounge beforehand. I was destined to continue my descent into complete and utter baldness.
Yeah, I mean, drinking in general is not that good for you, as we know. But in terms of surgery, hair transplant surgery, alcohol can definitely thin the blood, increase bleeding. And then also the liver is metabolizing some of the anesthetic that's used during surgery. And if your liver is not functioning right because you drink too much, that can, of course, affect the safety of the procedure.
Now, let me just caveat that I'm speaking from an entirely personal lived experience, and I have a desperately fragile ego. Some blokes go bald and embrace it. They own it like a badge of pride. These men are much stronger men and much more self-assured than me. So yes, I know this is very much a me issue.
So again, I'm trying to capture a view of his crown. From what I can tell, it still looks like it's fairly intact, but we will try to capture, like, for example, when you look from this more profile type of view, what I look for with the crown is like the contour as it comes up the occipital scalp over the crown and into the mid scalp. It seems like that's fairly maintained. It's maybe a little harder to tell with this shorter hairstyle, but from my view, I think it's has good preservation, which is very, promising when it comes to hair transplant surgery, because then you can focus more of your attention on one general area to try to get more impressive results. When you have multiple areas to work on and you have a limited supply of grafts like everyone does, that makes it more difficult to achieve great density throughout all areas, right? So this is a more favorable starting position for sure. But again, very important for him to, protect that hair and to keep it from falling out. That's why we always talk about the use of finasteride, namely for prevention, or dutasteride. And we have that at feelconfident.com. And that's extremely important. There's nothing out there that can substitute the need for that medication if you're looking to protect your hair. Because if you don't and you get surgery, then you have other areas that open up, and it's very difficult to continue to chase that and get excellent density results long term.
But I'm trying to be as candid as possible, just in case there's any men out there who are feeling exactly how I felt. Now, when I stopped drinking 18 months ago, a hair transplant became a possibility. All I'd need to do is face my fear of any sort of operation. I started doing my research. Was I too far gone? Did I still have enough follicles to save my rapidly retreating hairline? After a few texts and a FaceTime call to show them the situation on my head,
we can now see, even though again the hair is like buzzed down, but we can really see the density differences. So frontal scalp quite thin, then it gets thicker into the mid-scalp region, and posterior frontal scalp gets a little thicker. And then you can see the density start to drop again into the crown. He does have some inferior or posterior crown thinning as well to a degree. And then of course there's the donor area that overall looks a lot more solid. So he definitely has crown loss in addition to the frontal scalp and temple loss that we saw earlier.
They gave me some options. I read through it and got a serious case of the hits and just booked it.
And it's important to recognize that crown thinning, right? Because what that tells me is that, first of all, he definitely needs medical therapy. Secondly, we need to consider the proper allocation of grafts. And when someone has a lot of crown thinning, I usually try to create a more conservative hairline design, because it's always going to be better to build up stronger density in a conservative way at the hairline compared to dropping it too low and having a low hairline and then never really getting to improve the crown in any significant way. And then things look less natural, because for someone to have a low straight hairline, they're almost definitely, at least in the natural world, going to have a pretty full crown. You never see a person who has a low, straight, strong hairline and a thin crown. It just doesn't exist. So then it looks fake and, surgically altered, right? So that's what we try to avoid. For patients who have really strong preservation of crown and mid-scalp, and it's just a frontal scalp issue, we'll sometimes consider a slightly more aggressive hairline approach, sometimes incorporating the temples, because, we have that luxury in those patients, right? So that's why understanding the full scope of the scalp, understanding your donor capacity, what you can do, is very important for planning these surgeries right, so that people look good and normal, long term, not just like a year post-op, and not just for YouTube and Instagram, but throughout their regular lives.
I opted for the Sapphire package, which included a top-level surgeon as opposed to an expert, as well as a 5-star hotel.
I think it should always be an expert, when you're getting surgery. I don't think, it should be anything else. You should always be operated on by someone who's an expert in what they do. I mean, that's what I think everyone deserves.
It was 3,500 euros altogether. That does not include flights, which I had to book as well, and Manchester to Istanbul was around about 165 quid. I paid a £500 deposit to lock it in for November the 5th.
Yeah, I mean, this is largely why people go abroad for surgery, because it's cheaper, right? And, I respect that. Everyone's got a different budget. But when people ask, oh, why is everyone going to Turkey? Well, because it's cheaper. And, that's the number one reason. And then, of course, you have some people who, really research specific places, specific doctors, and they like their results. That's fine. Or I do have some patients where they request such low hairlines that I think are not realistic for them, that I tell them, look, you can look around, and sometimes they end up going to Turkey, because that's the only place sometimes where they'll offer them that type of hairline design. So, that's it's about finding the right fit. And for each person, it'll be something different. Patients who come to me for surgery are really into quality. They really want to look very natural, and they're very willing to have somewhat more conservative hairline designs. That being said, we sometimes do, very youthful temple work in the practice. But again, each case is different, and sometimes we can manage to do that, and other times it's best not to invest grafts there. And patients who come to me, respect my opinion on some of these matters and are not just like, oh, this is what I want and it's the only thing I want. If that's the attitude, then they're probably better off going somewhere else.
I waited for 3 long, hairless months to pass until the day finally arrived.
How are you feeling about tomorrow?
All right, mixed emotions, I think.
Are you nervous?
Yeah.
What are you nervous about?
I'm nervous because I'm naturally just a very anxious person, aren't I?
Yes.
So, when I get tattoos, I get anxious. Like when I'm getting it done, it's a long process.
You haven't been tattooed in a long time.
Because I hate it.
I find the people who have a lot of tattoos are sometimes the worst with the numbing shots, which is always kind of interesting to me. It's counterintuitive, but we do find that sometimes that's the case.
The pain, is that what you're scared about?
I'm more scared of like the reaction I'm going to have to the drugs. You know, the anesthetic they put in makes your heart go faster, and I'm funny about the heart, aren't I?
Yeah, the anesthetic usually has epinephrine that allows the blood vessels to clamp down so that there's less bleeding in the area where we're working. The epinephrine can, of course, have systemic effects, and it does. It will make the heart race temporarily. You know, when you first inject it, that goes away. We usually give Valium, and that will also blunt that reaction and response. But yes, it can make people more anxious, in that early period when you're just getting the injection. So it's something that, it's good to be aware that that's coming.
You'll be okay.
Got like heart palpitations and stuff. I'm sure it will be fine.
Fainting wouldn't be a bad thing.
If I faint, yeah, at least I'll be
You could be a fainter like me.
Well, fainting isn't great either. You can get hurt if you faint and you're standing and you fall, like hit your head. We have had patients faint even before the start of surgery, just from, I think, nerves, honestly, during marking one time, and another time even before we got to markings, just in, talking about the flow of the day. So, we always recognize that people come in with some degree of nerves, and we try to create a really, warm, nurturing environment for them. And when we do, we do one main hair transplant surgery a day these days. And that I think is reassuring for many of my patients that, all the attention is on them essentially, that will take great care of them. And that helps calm the nerves, I think, as well.
I'll go for the procedure. I tell you what I am looking forward to, and the reason why I'm like fine with all of that is because this is the alternative.
Okay, so we have a great view of the hair now. We see, again, what we saw earlier, that frontal scalp thinning, that improvement in that mid-scalp, and then again, that reduction into the crown. So I wonder if he has already been on medical therapy or if he plans on starting medical therapy. That will for sure improve the condition to a degree. It will look better, it will be stronger, and it'll be more primed for surgery. So usually starting medications, finasteride, minoxidil, at least a month before surgery is the way to go. And then you continue it, right, into the future. Maybe they'll talk about it, maybe they won't, but I am curious about that.
Is that luscious mullet a lie?
It was... No,
it's deceiving.
It was a little bit deceiving, but it's fallen out rapidly since then. My hair is rapidly falling out, in decline. Oh. This is a hairline on the way out.
Yeah, so again, one of the big tenets of hair transplant candidacy is that we want really good stability to one's hair, before surgery. So if someone is rapidly losing hair, that's not the time to jump into surgery. We want stability, and we want to then build on it with good surgery. So if I hear scenarios like his where there's rapid loss, the proper response is medical therapy for at least 3 to 4 months and then reassess for stability before planning the surgery. That is, in my opinion, the right way to manage patients from a surgical perspective. But again, every place does it their own way.
He has seen enough, that is it. So, I would say I'm nervous but excited as well to have actual hair again. Oh, yeah, there's a guy in there before with fucking bandage on it. This is like a surgery hotel, so everyone's getting something done. I'll be me tomorrow night.
At least he's not alone.
After a day of surgery. I'm excited, actually. After breakfast, I got picked up by another car and driven straight to the clinic. And that is where it all started to feel very, very real. All my apprehension and anxiety about the operation was slowly making its way to centre stage, but the staff were well sound. They spoke fluent English and made me feel safe from the off. After a very brief wobble reading the disclaimer I had to sign that essentially said, in a long-winded legal way, that if I died, it was my fault. Regardless, I put pen to paper.
I mean, in all seriousness, there have been 2 recent deaths in Turkey from hair transplant surgery within essentially the past 6 months. So I think it's important to consider that, these things do happen, and sometimes the exact reason is not always made clear. And it seems like sometimes things are brushed under the rug, or initially there's a report and there's an investigation, but we never really find out the result of that investigation. Most common reason for these deaths is too much lidocaine, essentially. So lidocaine toxicity. So, it's just something to be aware of, that, it seems like hair transplants are so safe, but there really is risk associated with these surgeries. And some of it comes from the actual anesthetic that's used.
I was lucky enough to have my incredible wife by my side. One thing I will say, if you're going to do this, go with someone who can look after you. Not only for support, but it does get a bit hairy, for use of a better word, and that extra helping hand is absolutely vital. And we were a go. I had a blood test to make sure I didn't have any mad diseases, and I got a cannula put in my arm for the painkillers I'd be needing in a few hours' time.
So we don't routinely get blood work on every single patient. In my consultations that, I do by myself for surgical patients, I always ask for, all types of medical history. If I hear something from the medical history that gives me pause and alarm, then we, of course, will get either medical clearance or blood work. But getting routine blood work on everyone isn't, the gold standard practice, but I think there's nothing wrong with it. And you might detect something, but the question will be like, what will you do with all that information if you see that there's a slight abnormality on the results? So usually getting a sense of the person's medical history is sufficient. And then, of course, we do vital signs on the day of surgery. If anything is drastically off, or if the person just doesn't seem right, then we just don't proceed to surgery. But as far as like starting an IV, we don't do that for patients. We just give oral sedation, Valium, Ambien. It's very rare for us to give a painkiller during the surgery. Patients can get a painkiller that they can use after surgery if they need it. But to give painkiller through the IV, I think can be excessive.
So just to clarify here, I just had a blood test, and Sarah's the one who's going to faint.
Then I was taken through to meet the surgeon. He checked my donor area, which is what they call the area of the head that they extract the hairs from that will be put into the bald areas, to check how dense the hairs were and work out how many grafts I'd need. My hair was much thinner than they'd anticipated.
Because he wasn't pre-medicated with finasteride and minoxidil. If he were he'd be in a better position going into surgery. Because remember, hair transplant surgery is controlled trauma to the area. And sometimes what people don't realize is that just the act of doing the surgery can actually make some of the hair fall out more readily. And that we call shock loss. But sometimes that shock loss can be permanent if the hair was already teetering on collapse and you came in and you stabbed it with all these, incisions and grafts that you put in the neighborhood. So that's why you want the hair as strong as possible leading into surgery, not just something that you might consider starting, after surgery.
I need the maximum amount, of the graft. So 4,500.
Bye-bye, Humpty Dumpty.
Yeah.
In Turkey and some other places, they're all about sort of maximizing the surgery as far as the amount of grafts that are transplanted. For some people that works out great, but for others, it doesn't. And then if you blow through most of the supply that one has in the back, then you don't have too many options for correction. And that's sometimes the types of people who I see in my practice, where they had surgery abroad and now they don't really have too many options. They still are thin in different areas. And it's kind of like they're stuck with it. So I think it's like throwing up a Hail Mary. It's not my favorite approach. Also keep in mind that A graft in one clinic is not necessarily equivalent to a graft in another clinic. If one clinic uses a very small punch size, which might sound nice because then your scars are smaller, they're almost definitely capturing fewer numbers of hairs per graft, compared to a clinic that uses maybe a slightly larger punch size that is still safe and still yields good scarring, but a size that will give you a very healthy, say 3-hair, 4-hair graft that will carry a lot more weight in the recipient area. So it's really ultimately at the end of the day the number of hairs that are placed rather than the number of grafts. So if I did 5,000 grafts where most of those grafts had 1 or 2 hairs, that's a very similar outcome potentially to doing, say, 2,500 or up to 3,000 grafts, where a lot of the grafts are 3 and 4 hair grafts. And so that's something that people don't like to talk about, especially if they're just charging per graft, but that's the truth. Again, there's a limited supply and you want to manage that donor area well over time. So not scarring it up too much in one surgery is usually the best approach. But again, everyone's got their own methodologies.
The surgeon drew on where he thought my new hairline should go.
So let me just go to the design here. To my eye, from what I can tell, there's like a white mark and then there's the purple mark. And I think the white mark is meant to show like if they went, really, really low and really, really straight versus something that they probably consider slightly more conservative with the purple mark. But again, that is still quite low for someone in his shoes that's starting off with so much thinning. Because just in this frontal centimeter, right, you might need about 800 to 1,000 grafts for really good density. So imagine how many centimeters, you would need to then cover and how many grafts that will take. And then what about the crown, right? So you have to consider the overall graft capacity and not place the hairline too low, especially in a case like this.
And explained in graphic detail every aspect of the decision-making process. They got rid of the final remnants of hair that were there, ready for a fresh start. I was ready. It was time for the operation.
Going through. See you later. All right, I'll take this now. See you in a bit.
So we see the recipient area here marked out, and again, still in my eyes a bit low, and you can see they're working into the forelock. They're not really reinforcing the entire frontotemporal corner, but a segment of it. You can see that half circle there. And the donor area is coming up, pretty close to the recipient area there. And from what I can tell, they've also marked out the crown as well.
The bit I feared the most was how my body would react to the anesthetic. They don't put you to sleep, it's all local. And I've been with people where their heart starts racing dead fast as soon as it's administered before. Now, having a heart attack is literally my biggest fear. Ever since watching Clark Kent's dad have one in the 90s New Adventures of Superman series. So I was absolutely myself. But thankfully, I was fine. They gave me loads of little injections of anesthetic directly into my head. It felt a little bit like being stapled with a staple gun again and again. A lot of people say that this part is the most painful, but because I was a special case, it got a bit worse for me. More on that in a bit.
I wonder what made him so special. But yeah, it looks like they started with the harvest, which is sometimes what people do. Usually we'll start with the recipient site making. That will inform the number of grafts needed, and then we do the harvest and then the implantation. But from what I can tell here, they're using a sapphire blade to make recipient sites. That's probably once the harvest was done. The other reason to start with the recipient site making first is that by the time you have your grafts after the harvest, you're ready to place right away. The only other scenario where you minimize the time out of body for grafts is if you do the harvest first and then you jump into sharp implantation, so implanter pens. Then again, you're minimizing the time spent out of body because you don't have hours of making sites potentially and then placing the grafts, since it's combined into like a single process. But in my case, with pre-made sites, to minimize time out of body, we usually start with the sites, then the harvest, then the implantation.
Once my head was numb, it was time to start taking the grafts from the donor area. For this part, I genuinely couldn't feel a thing. So much so that I drifted off to sleep.
A little 5-minute break. I've been sleeping. If you couldn't tell, I've got sleepy eyes.
So you can see the harvest there completed, and they probably started to make some sites in the frontal scalp from what I could tell.
Thank you so much. My grafts are just on the table there, so I'll just show you what these look like for a second. It doesn't hurt at all. The anaesthetic was the only little bit, but they were little pinpricks, that's it. 3,000 grafts there, 4,500 I think, maybe more we're gonna take. For the second and third part, I'm allowed to actually be on my phone and have headphones in as well. So I've got my AirPods, gonna listen to some tunes, watch some stuff, and yeah, it's going well.
So he's saying they already took 3,000 and they're planning on taking another 1,500 from what I could tell.
After a short food break, the surgeon came in with some bad news.
So they need more because I've got hardly any hair at all. So they're going to take some from my beard as well.
So it seems like they got through the entire donor area and yielded 3,000. And somehow, I guess we're hoping for some miracle that they would get 4,500. So now they're probably trying to go into his neck hair for some additional material.
So I'm going to have some more anesthetic now and a bit of a shave. So next time you see me, I'll look weird. All right.
Despite them taking the maximum 4,500 grafts, they still didn't have enough hair to cover my epic baldness.
Okay, so it sounds like now they have 4,500 between the scalp hair and the neck hair, and they still don't have enough to cover. But again, this shouldn't have been that surprising, because considering how low they've marked out the hairline, just to reinforce the front could have taken 4,000 grafts. But then they're also planning on doing the crown at the same time. So then they're like, oh my God, how are we going to fill the crown, right? But if this was properly planned out, this would have been done in 2 separate surgeries and with a more conservative hairline, so that you shrink the amount of overall coverage that you need to be able to boost up density. I mean, that would be my approach.
The anesthetic injections under there were not fun at all. Easily the worst part of the operation. 7 out of 10 for pain, and the fact that it was an unexpected extra after hours of laying there when I thought we were about to move on to the last stage didn't help.
Yeah, and that's again why, if there's the potential for neck harvesting, I will warn the patient, way in advance that there's that possibility during the consultation. It won't be something last minute. And that, again, prepares people to be in the right mindset and not, have any surprises on the day of. The neck numbing does not have to be that painful, again, if it's done carefully with proper ring blocking and then tumescent solution. With the neck harvest, you have to be careful a bit with the marginal mandibular nerve. So I always mark out for the facial notch, and the marginal mandibular nerve is going to travel fairly superficial within about 1 centimeter of that notch. That's very important to do because, we don't talk about this enough, but if you go too wild with a neck harvest, you can potentially ding that nerve, which will then change how your lip moves.
We are on the last part now. This next part is the last part. I'm going to put that hair in my head, and it takes 3.5 hours. So, yeah, overall, this is going to be almost a 10-hour procedure.
These are long days. Hair transplant surgery, to do it well, definitely takes a long time.
Mine is extreme because I was very, very bald. Don't think it's usually this long.
But again, you don't need to try to get it perfect, everything super dense with the first surgery, right? There's something to be said for just proper allocation of resources and building things up gradually. And again, it's a different philosophy. Some people want a one and done, but what they usually find is that it's not really still a one and done when you have multiple areas to cover.
Listen, I'm keen, I'm down, I'm ready. My body is ready.
The other nice thing about staggering surgery is that, let's say you work into the frontal scalp in the first surgery, and then you kind of know you'll be back to do the crown with the second surgery. Some of those grafts you can actually allocate back to the frontal area to boost density in some key sections where, maybe things, would just be nice for it to be a little bit stronger in some key areas. So if you put 2,500 grafts into the frontal scalp and then you plan on doing, let's say 2,000 into the crown, you can then maybe allocate 500 grafts back into the front. But you know what I mean? You can put 500 grafts into the front again the second time around to boost that density even more. But if you just exhausted all your supply and you just put it somewhere and then you realize, oh man, I'd love to have more density in this spot. And then you're like, oh wait, I don't have really much supply left. That's a bigger problem.
My head is ready. My jaw is ridiculous. And Here we go.
Finally, they had enough grafts to proceed. This bit was so weird. They injected saline into my head, so they weren't making incisions directly into my skull. So there's a little bit of room between the bone and the surface of your skin where the grafts can bed in. Now, I couldn't feel any pain, but what I could feel and hear was my head popping every time that he made a little incision. It's a really hard sensation to describe, but in a way, it was oddly satisfying.
It's a little bit crunchy, but that's okay. So it looks like they have made some sites. So they harvested first, then they made some sites, or they made some sites earlier and then made some more sites. And now they're finally placing grafts into those previously made sites. And they're placing them with forceps from what I can tell, which is a classic way of doing this. And we actually use forceps too at this time. I've played around with implanter pens, but my team is very experienced and is very comfortable with forceps. Forceps placement it works. It's a great technique with properly trained individuals. So that seems to be what they're doing here.
The next few hours were a slog. Sitting there just that operation. No TV, no nothing.
We have a TV available for patients and some nice music and conversation, and that gets people through the day very nicely.
It was pretty bleak. If you're gonna get this done, bring an iPad to watch your favorite show. In hour 6, I started to feel really Luckily, it coincided perfectly with the exact time they brought out the painkillers.
We have 1 more hour to go. Got painkillers here and some antibiotics, I think. That's nice. So I'm looking forward to this being done. I'm knackered. Absolutely knackered now.
It is a lot of time in a chair, that's for sure. So some people feel like, their backs start to ache after a while. We have purchased a very thick mattress pad to help with that onto our surgical chair. But, some people feel their backs a bit more than others.
Almost there.
From then on, I sort of floated through the rest of the operation. From start to finish, including the lunch break, I was in there for 10 hours. Much longer than anyone else I've ever spoken to who's had it done. So, in a way, this is what the worst case scenario looks like.
Okay, so this was the frontal scalp here, and then it looks like they reduced the density heading further back into the crown.
And honestly, it wasn't even that bad. And I am a proper
Morning. It is 7:30 in the morning. Just woke up. Slept pretty well, to be honest with you. Slept with a pillow around my neck. Look at what's come off.
Yeah, and that's even with bandaging of the donor area. But we actually don't do bandaging of the donor, and people do great. I mean, you could have some blood-tinged spots, but usually not as much liquid as he has there on that chuck. So not sure what's causing all that, but even through the bandage, it looks like he's leaking a bit from that donor area.
Look what's come out of my head. It's a little bit of blood, a lot of that saline water, which she said was completely normal. And then, yeah, it's not too swollen yet.
The thing about the neck hair is that even though it tends to grow well on the scalp, it does come in more curly. So it's important to not place that right at the frontal scalp and to put it further back if you're going to use the neck, because that hair will look a lot more wiry and curly.
Hurts a little bit, it's sore, but got some more paracetamol, so gonna have some of that. At some stage they're gonna message me, let me know what time I've got to go back in, and then they're gonna show me how to wash my hair. So until that point, I'm going back to bed.
The next day, I went to have my first wash and for them to check everything was all right with my big, stupid, swollen head.
I don't like the headband because it just creates a lot more swelling where the grafts are. I'd rather that swelling start to descend down the face versus, just restricting it with the headband, and then everything just kind of blows up like a mushroom, and then it'll still descend down the face anyway. So that's why I don't like to use these headbands. Going back in the next day is fine. We don't find that to be necessary for patients. If you give them enough instructions and all the, equipment and tools they need afterwards to take good care of the donor and recipient areas, we find that they do great, and they'll, patients get my cell phone and they do great. So that's totally fine. But I think seeing them the next day for a wash is okay too.
We are looking horrendous. Look how big my forehead is. Jesus Christ. Oh my God.
Yeah, because now that swelling still has to drop down. So, it just kind of makes it look sort of ridiculous, and it'll still be descending. So that's why that's a no-no for headbands for me.
I've just taken my headband down. Oh my God.
Plus, when you're manipulating this headband around your forehead, around your grafts, there's, of course, a higher risk of potentially disrupting the grafts. I tell patients, unless you're in front of a mirror, don't bring your hands above your shoulders in the first 3 days. So then if they're moving around their headband, they might forget to be in front of a mirror. And the next thing you know, you pop some grafts out. So I think better to avoid the headband.
I look like I'm wearing a hat. Sarah, come and have a look at this.
Oh my God. You look more like Megamind. Oh my God.
Oh.
Good thing that look is temporary.
You actually look
It
like
really hurts to take this off, by the way.
You actually look like Megamind.
Does the back of my head look okay?
Okay, do you mean not swollen?
Yeah.
No, it's swollen.
Oh God. Is this going to go down? It will in an hour, won't it? Oh my God, you're going to go down all the way across my face?
That ain't going down tonight, love.
Is it going to swell up all over my face?
Now the swelling got worse and worse and worse.
I can't see. When I laugh, I can't see.
That's my point. It's still coming down his face. So let that just happen naturally. And with the use of Kenalog during surgery and prednisone that we give patients at the start of the surgery as a pill, we really avoid most of the swelling. My patients rarely swell to this degree. I mean, it's possible, but it's so rare now in the practice. It seems like the most replayed part of the video too. So people really want to see the swelling. But again, it's usually not this dramatic at all in my practice.
We're on day 5 here. And got a little bit of bruising.
And bruising is actually quite unusual after a hair transplant. We almost never see bruising for scalp work. Around the eyes, when we do eyebrow hair transplant, we can see bruising, but for scalp, it's actually quite uncommon.
My eyes are a bit less puffy than they were yesterday. I can actually see, which is great. Feeling okay. Just a bit. Just want it to heal now. I want everything now. Life don't work like that, unfortunately. So I have to play the waiting game. Been exactly a week since I had my hair transplant.
So at a week, I'd like to see him working out those crusts. Usually we advise at day 6 to start showering and to start to lather some baby shampoo over the transplanted zones to start day by day to working out the crust. You want to see most of those crusts gone by about day 12, 13, and definitely not beyond 14 days.
Swelling's completely gone down, which is fantastic. Still a bit scabby on the top there, which is fine.
Yeah, even when the swelling gets really bad, usually by day 6, 7, it goes away.
They come off, as I said yesterday, after 10 days. Feeling good, feeling fantastic. 7 days. Day 12 now.
Get those scabs off, come on.
The scabs are coming off.
You can use some baby oil during the day to try to soften things up and then just continue with the lathering. It just means that he's not working it hard enough. That's why he still has the scabs.
And some of them are coming off with little bits of hair follicles in. According to the insert, that's absolutely fine.
So typically that's just dead skin and sometimes the actual shaft of the hair with some early shedding that may already be occurring. It's rare for it to be the actual follicle, especially at this point. Usually within the first 3 days after surgery, the actual follicles are secured in.
Yeah, if you look, I don't know if you can see that falling off. So it is slowly but surely shedding.
Yeah, and you can see that pinkness to the area. That's going to gradually subside.
Which is a good thing. It is literally 3 weeks since I had it done.
It can take, honestly, up to 10 to 12 months for the redness to completely go away or for the pinkness to go away. But for most people, by about 4 to 6 months, it's usually gone.
It's all fallen out a little bit, and then we come back stronger. Right. It's all started to shed now, which is lovely. I look bald again. Back to square one.
Remember, sometimes you can get some shock loss for the neighboring hairs. So, it's not just the transplanted hair that falls out, but usually to some degree, some surrounding, original hairs can fall. We use PRP during surgery and then can reintroduce it as early as 3 months post-op for trying to reduce that shock loss. That seems to help to a degree.
This is a normal part of the process, I'm told. I'm not worried at all. I'm not worried that I've just spent £3,500 and it's falling out.
I am an incredibly impatient human being. So when the growth wasn't as fast as I'd hoped, I lost the motivation to do these daily updates, but I didn't stop making videos.
Oh my God. It's happening. It's happening!
I mean, it's still so early, so, he should be happy that he's seeing some regrowth at 41 days.
It's happening! We're growing actual hair. Top. Wow, it's been a long time, hasn't it? Right, so we are now 3 months in. 3 months.
Yeah, 3 months, you're usually back to your original configuration with some additional gains from the transplant. You could see the skin is still pink in his case. Some transplanted hair is starting to come in. So that's, usually what it looks like at 3 months.
And this is the growth. So it's pretty slow, if I'm honest.
Standard. I mean, this is standard. You just have to be patient.
But there is definitely progress being made here. On the top, it's still, it looks pretty bald still, but after 6 months, it's gonna look good, promise you.
Looking back now, it happened really slowly to begin with, but then all of a sudden, after about 5 months, I looked in the mirror and sort of realized I have hair now.
Right, look at the state of this. This needs cutting.
Now listen, this hair transplant is genuinely one of the best decisions I have ever made. Between that and getting sober, I've gone from a pit of depression, anxiety, and self-loathing to being able to get out of bed, feeling good about myself, gaining confidence, and having a newfound love for life. I'm not saying that the hair transplant is the sole reason for that, but it massively helped alongside a load of other variables.
So with this zoomed in image here at the hairline, we can still see, some thinning there. And of course, it's better than where he started, but, he might want to one day reinforce that hairline. And we're not seeing that kind of top down, image, but, I think what he's doing is kind of combing the hair back so that crown's getting better coverage. But I'd really like to see everything actually combed down so you could see those densities. And I think what you'd find is that that crown can still use, a lot more grafts. And, that's just the nature of hair transplant surgery when you're starting off with so much deficiency in those regions. And so, the point here is that when you have this much loss, you shouldn't see it as a one and done. In most cases, when you're going in for hair transplant surgery, seeing it more as a journey of making improvements over time, I think is a better approach, and also being on the right medical therapy. So I'd love for him to, be on finasteride, minoxidil to make these results last and to make them pop as much as possible.
A year later, and my hair is going from strength to strength.
Yeah, you can even see there on his left frontal scalp, there's quite a bit of light penetrating there. So, frontal scalp can use some more density, and we still haven't really seen the crown very well. Listen, I'm very happy for him that he was able to, seems like, turn his life around and gain a lot more confidence. That is always the goal. That's why I called my brand Feel Confident. That's what the whole point of all this is. But I will say that despite the 4,500 grafts that he had, there is room for more. And because the hairline was started at that low point, there is now an even higher need for grafts, right? He could have kept it to about 2,500 grafts with a more conservative design for the frontal scalp that would have met up nicely with his already fairly thick mid-scalp region. And then a secondary procedure of about 2,500 grafts for the crown to really give him nice, strength there. And I would have taken that most likely all from his scalp hair. And then I would have saved his neck hair for, just the future, for potential fill-in if needed. But in most cases, we get about 6,000 to 8,000 grafts from people, but we don't get that all in one day. So again, different approaches by different clinics for different people. And you just have to do your homework, find the place that feels like the right fit for you. Thanks so much for watching, and I hope you enjoyed this reaction.